Hello, good afternoon, everyone. Welcome to this webinar where we'll be talking about self-medication, how to avoid drug misuse, overdose, and other issues. My name is Dr. Tulokpo Oyewole, Utilization Manager, Avon HMO. So here with me today, I have Dr. Ejinkeonye Oguguah. Please correct me if I got it wrong. He's a seasoned medical expert with over 21 years of experience in medical practice. In fact, he was part of the startup team for the Freedom Foundation Drug Rehabilitation Center, where he worked with them for over 4 years. I think it's a very huge privilege that we have such a person in our midst today. And I hope that after this session, our listeners will be able to learn one or two things about this topic and apply in their day-to-day lives. So let's get right to it. So, Dr. Ejinkeonye Oguguah, can you please introduce yourself to the team?
Thank you, Tolo. My name is Dr. Oguguah. I'm a medical practitioner. I've worked both in curative, preventive, and drug rehabilitation, HMO, and I consult for a lot of other organizations. And right now, I'm working with Avon Healthcare Limited.
Okay, Dr. Oguguah, thank you very much. Let me go straight to the questions. There are a lot of people that are not clear about self-medication, really. On one hand, it seems okay to pop an over-the-counter pain pill. For example, the usual one that everybody pops, paracetamol. It's easier to just take it whenever you are feeling some type of pain. And on the other hand, self-medication can have serious consequences. Please, can you shed some light on this?
Thank you very much. In this part of the world where medications are not regulated, and we have a lot of people buying drugs off the counter, so we will have a lot of self-medications going on. What exactly is self-medication? Is you taking drugs not prescribed or advised by a medical physician for a condition that you feel you are going through. So when people decide to go into self-medication, is built to the fact that they feel that they know what they are doing, which vis-a-vis it may not be correct, and they decide to engage in drug taking. Especially the fact that you mentioned that paracetamol, which is the biggest culprit in Nigeria, everybody just swallows paracetamol in different dosages, such as 1 tablet, 2 tablets, 4 tablets. In fact, 6. I've seen somebody taking 6 tablets because he said the thing is not working as quickly as he wants it. But we forget that all these are chemicals and they all have effect on our liver. And that's why in developed countries, most of these drugs like paracetamol have been put on prescription medications that you can't just buy it over the counter like that. So when we look at it from the hand view and learn that one, yes, even though self-medication has its own benefit in terms of it reduces the time to go to the physician, or you helps you to interfere in your own treatment plan, but the side effect of it is worse than the benefit that we get from self-medication. So I feel it's time for us to actually do the right thing and also have the right advice before we take any drug.
Thank you very much for that, sir. Um, From my own experience, I've had the patient say that, oh, Dr. Tolu, I need you to write another prescription for me for antibiotics. And I asked the reason why she wants an antibiotic. Does she have any infection? Did she do a test that says that this is the particular antibiotics that works for this infection? And she said no. She simply said that she was told by a friend who has been using antibiotics for the past 3 months that it's enables you to have a clear skin. You'll be able to achieve a clear and smooth skin, and that she wants to um, be able to have a clear, smooth, and shining skin. That in fact, she even wants to brighten her skin, and that she doesn't want to use the organic bleaching products. And of course, I had to educate and emphasize that that is not the use of antibiotics, right? Can you just shed some light about the popular use of unprescribed antibiotics across board in Nigeria?
Thank you, Tolo. This is a common issue we see among the youth right now, that people are looking for a way out regarding their skin health and their beauty. So they believe in all the propaganda that we see all around us in order to help each other get better. But forgetting that antibiotics itself is a drug. It's not a cleanser. It has a specific action it's meant to do in the body. And when you abuse it, you create what we call resistance, which means that the next time you want to use that drug, it won't work for you anymore. So when people come, and again, the danger about such things and such people that do those things is they don't take the drugs as prescribed. Some people either take it, instead of taking 2 tablets every 12 hours or every 6 hours, they will take 1 tablet every 2 hours to feel that the more I take it, the more effect I see on my body. So let me quicken my cleansing process in my body. So you'll find that it's from the literacy program that we are having, that a lot of people are uneducated about the proper use of medication in this industry. So especially in the part of the work here. So what we would say about this is, one, to all the young people actually looking at how to have a better skin and how to improve their skin health condition, it's quite simple, and the rules are the same all over the world. Drink a lot of fluid, have enough bed rest, exercise properly, eat healthy meals, avoid junks, and you will find out that your skin will glow naturally. There is no better way of dealing with health skin than allowing the body to actually regenerate itself by itself.
Thank you very much, Dr. Oguguah. I heard you speak about the benefits, in quotes, of self-medication, even though you also said that the benefits outweigh the risk, right? So actually, when is it okay to self-medicate? And when would you advise against self-medication?
Okay, very good. When is it okay to self-medicate? I would say, in what situations are self-medications advisable? What I would say is, one, when you notice that you are having initial symptoms that involves aches and pain, and you feel that, oh, I'm having, I had a spot and I had just a bruise and I feel a pain, and you take something like Panadol, or you apply an ointment to relieve of your pain. But we all know that when the condition persists, it's not something you can actually continue to linger on and keep on taking the paracetamol, because what you do is that you postpone the evil day. So when is the time to, if you feel the headache persists, I would say after 24 hours, please see your doctor. Just speak with somebody that is a medical professional to find out what exactly is going on. It might just be a stress-induced program. It might just be lack of sleep. It could just be a major tumor actually playing around the nerves. So before we proceed and say we have gone to go and buy a packet of paracetamol and we are now swallowing all what we can find, it would be nice to say at this point, I've been taking paracetamol for the past 24 to 48 hours. Let me seek an advice. And that goes for every other conditions. In fact, you are not even meant to self-medicate when it comes to antibiotics because it is specific and it is deliberate. When you prescribe such drugs, which is based on a diagnosis, we don't just give antibiotics for the fun of it. Is after you have run some tests and we see that the result has a sensitivity to this, then we are not saying that, okay, this is the drug we're going to give for you that will relieve the turn for or the condition you're going through for this period of time. And it's not supposed to last forever. So if you notice the difference between the self-medication and the actual treatment is cast on stone. There is a duration, there is a diagnosis, and you are treating a condition you know. Unlike self-medication that you are just popping and hoping that what you are feeling goes away. Most of the time, feelings don't go away. Yeah, even when you take the antibiotics, you have to give it time for it to flow, for it to build its own threshold and be able to fight the infection inside the body. So when we say self-medication, please, within the next 48 hours, if you don't feel good, please speak with your health advisor for him to tell you what to run, what tests are we going to do to help us go to the next level.
Thank you very much, sir. There's this particular misconception in quotes that many people do. People just say that, oh, I've not treated malaria in a while. Let me take anti-malaria. Or people say that, I'm feeling feverish. I think it's malaria. Let me take anti-malaria. And they take it for 1 day or 12 hours or less than the usual time that it is supposed to be prescribed for. And they get better, right? And then they move on to the next thing. And then the next 2-3 months, they have the same feeling or feel the same symptoms and pop it again. I just wanted to shed some more knowledge about this particular anti-malaria topic, or yes, anti-malaria topic and anti-malaria abuse.
In the country Nigeria, we found out that most people are what we say malaria experts. When you when you have any condition that looks like malaria, everybody tells you, it is malaria. The last time I took this, I took that, I took. So everybody keeps giving you the 1 million advice that you can get. And as long as you have the money to purchase, you'll be buying all. I've seen people that took chloroquine for almost 6 months in the process of treating malaria. I've seen people that have decided to mix 2 or 3 brands of anti-malaria drugs just to say for them to have what they call the perfect treatment. But all this goes to the fact that we lack the knowledge concerning treatment, and we do not understand the purpose of healthcare. The physicians are there to actually make sure that your usage or proper usage of medications are done under reasonable conditions, meaning that it's not all the time that you have headaches, body pain that actually means malaria. In Nigeria, we have most people will tell you that you have body aches, you have temperature. It could just be that you did not eat properly, or you lack sleep, or you're under a lot of pressure, and your body is just reacting. Most of the time, when I see people coming down with such things, and you run the malaria parasite test, you find that it's negative. And at the end of the day, we'll tell them, you know what, go and rest, eat well, and let me see you in 2 days' time again. And the person feels, this is not a good doctor. How can you tell me, with all what is going on in my body, that I should just go and rest? And by the time they obey those simple instructions, and I tell them, eat well, drink a lot of water, and come back in 2 days' time, and I will review what's going on. They come and say, doctor, in fact, that advice you gave me worked though. I say, I'm not here to collect your money. I'm here to make you better. If you take drugs, it doesn't add to me, because I know the effect of the drugs in your system. So abuse of malaria has been a common event that people need to be tested before being given any medication, and the test needs to be confirmed positive for you to be on the drug for a specific period of time. And two, when you take the malaria drugs, you need to be careful not to combine it with any other thing, especially vitamin C. We have discovered that most people take anti-malaria drugs and say, I took that drug, I did not recover. I took that drug, it did not work. That hospital, they're selling fake drugs. It's not the hospital. It's actually that you did not have the advice or the needed information that you need to take the drug. So most of the time now, we always tell them, when you are taking this, please do not take anything vitamin C. Now, going to vitamin C, people assume vitamin C is just a tablet vitamin C. They forget that our fruits also contains vitamin C as well. So they will take every other thing and tell you that they are not actually taking tablets vitamin C. So unlike you going to Chuku the chemist that will pack vitamin C, vitamin B, everything to you, they'll say, I don't want vitamin C. Because the doctor said I should not take vitamin C. So they remove, but they will go to the shopping mall or to our market and buy oranges and fruits and apple and everything, and they will start swallowing and say they are taking smoothie. Along with their treatment. And the next thing you'll find out is that after 2-3 days, the malaria now resurfaces back. They feel better for 48 hours, and in the next 4 days, they start having the same symptoms. Why? Because the vitamin C has actually helped to neutralize the effect or inhibit the effect of the anti-malaria drug that you have taken. So you are not getting the right dosage that you're supposed to have taken inside your system to be able to neutralize the effect of the malaria parasite. So those are the things that we should look out for when we take the malaria test, malaria drugs or anti-malaria drugs. One, we should ensure that our tests are done before we commence on the treatment. And when we commence on the treatment, we should be sure that we are not taking anything that contains vitamin C. Thank you.
Thank you very much, sir. Okay, now let's begin to talk about drug addiction, right? Drug addiction is a very broad topic, and it's also a very important one. What are the circumstances under which a person can be addicted to certain drugs?
When you look at it in the country, drug addiction in the country is a major adverse effect affecting the youth. Before we say it's the affluent people or the people that have enough ability to purchase it. But we have discovered it's not just only people that can purchase it. We also discovered that it is common across all age bracket and across all social economic capacity or influence. When you talk of drug abuse, it ranges from your paracetamol to your cocaine, heroin, and co. We try to see what is the common thing now in Nigeria is the codeine fancied or hype that is going around the whole place. If you're in from the north, you will find out that what most people are looking at is the gum or rubber substance that they inhale, and you are in the east, you'll find out you are having the tobacco program going on. So in every joke political zone in Nigeria, we have something that is being abused. And what are they actually looking for? It is called the pleasure center in the brain. There is a center in the brain that actually gives you what they call a pleasurable feeling. So people want to experience that same effect when they took the first thing they took the last time that gave them that effect. That's why we see that people that say, I'm stressed out, I want to go and have a drink. Because the first time they took a drink, they felt good. They were high, they were alive. Let me say that. And that's why you find out they go back again to have that kind of kick, if you use that word. And that happens across the system. You'll find people telling you that I'm taking, I don't sleep well, but when I take just simple days, I feel good. It's an addiction program. So you'll find it across every sector, even in the workplace. You'll find people actually having to use substances that can keep them awake because of the kind of lifestyle they live. Because we have decided not to follow the normal rule of actually enjoying our 6 hours of sleep, which in Lagos, I think getting a 6 hours of sleep is something we can work towards if we really want to get that amount of rest. So if you look at it, it's just a desire, or I would say it's an unwanted desire that your body is craving for to give you a pleasure that you really want to have, but you don't need it.
Okay, so some people right now may be confused about, okay, we are talking about drug abuse and now we're talking about drug addiction. They seem a bit similar. What exactly is the difference between drug abuse and drug addiction?
Now, the two are both substance abuse, but the degree to which one is being looked at is what differs. Drug abuse is you using drugs that is not prescribed to you for a particular condition. So if, for example, you want to, you feel like taking paracetamol because you feel you have headache. Instead of it to have a power nap and you will be better off. And you feel that, let me take the paracetamol. Or you feel that you have eye issues going on and you decided to use chloramphenicol for your eye, which is not actually given to you. That's just to put it in a simpler way. The same way that we say people take marijuana and they tell you that it helps in their creativity or in their ability to imagine better. And you find those things very, very amusing. And before you know it, it's just a thin line between the addiction and the abuse. Where are we getting the addiction from? Now, when you say the abuse is you are now doing it on a regular basis, and it gets into the addiction where you cannot control yourself again. You cannot stop yourself from not using that drugs. We see a lot of people on the road and you're wondering, why is this man removing all his clothes? In the morning, he was properly dressed, and in the evening, he's now naked. What happened? He couldn't get his kick, and he needs the medication to be able to function normal. Now, once you get to a position where you cannot function normal without a drug, it means the addiction is actually already on. We don't wait for you now to get run mad or when we admit you in the psychiatric home before we know that you have such a substance abuse. Once you get to a point where you cannot do without the substance. We have different kinds of addictions. Some people are addicted to what's it called? The phone. Texting, social media, they can do without. So the addictions are now increasing with the degree of development or exposures we are having. So in terms of substance abuse, it's also what we are looking at to say, how do we ensure that people get treated for what they need and not what they feel like needing? I bet if you, in your practice, you will have seen a lot of people coming to you to say, doctor, I think I'm still having this pain and I need this painkiller. And you will just mention, okay, why not take paracetamol for this? Doctor, paracetamol, no, they work, no, they work. I need that other one. You know, that special one you gave me when I finished that surgery. Because what he wants is that Superman effect. And it's not that he's having any pain. He just wants to have that Superman effect, the pleasure of achieving great results, which is not which is a fallacy in his own mind. So we be able to identify them and say, "Come, you need help." If you look around your environment, even in your offices and your household, you'll be able to identify people that need help in terms of drug or substance abuse. Some may not be medication straight away, like antibiotics, painkillers. Some may be alcohol, some may be cigarettes, some may be tobacco, but we will find it if we actually look properly. And that goes for parents too, to be sure that your kids are not playing the fast one on you. To say, Mom, I'm still feeling the pain, and you are checking to be sure whether the pain really exists or it's just that the boy just wants that drugs because he have a good flavor. You know, now we flavor all drugs, so most of them would like to take all the strawberry flavors and keep taking them. Meanwhile, they don't know the effect of it. So we have to control what we do for them. I hope that works well.
Thank you very much, sir. Yes, in my little experience, we've had patients, especially sickle cell patients, that are addicted to a particular painkiller. Now, they're not in any crisis, they're not having any pain, but they just might linger and say that, oh, they're having bone crisis or something, and they will insist on the particular medication and say, I want pentazocine, I want betadine, I want this, I want that. That is what cures my pain. I know my pain, that is what cures it. And then on doing your investigations, you find out that this patient is actually perfectly healthy. I mean, it's just because of they've achieved that pleasurable feeling in quotes. And sometimes even when they now come down with the crisis and you now have to administer these painkillers to them, you have to do it at an higher dose or change it completely from what it is to another one, causing more effect. Okay, the next question. What are the risks associated with drug addiction?
Wow. The risk questions. You know, throughout my career, you know, I've working in drug rehabilitation center, I've seen a lot of broken hearts, families, parents, sisters, and you will be amazed on what goes on. It disturbs the family. It causes a family breakdown. In fact, it leads to marriage, separations in some cases. I'm just taking it from the family point of view. Also leads to what they call lack of funds. And when you look at it from the family sector first, you will know that this drug addiction is not just the individual, it affects the entire uh, uh, scope in terms of him, his family, and his environment in general. So with him alone, his own case is if he's endangering himself physically, mentally, and health-wise in terms of he will do unsafe programs, take needle exposure because he just wants what he wants. And again, he puts his liver into a dangerous position where we will not be able to help, and it increases the cost. Then also in terms of its funds, it will become less dependable. He will not be able to meet his normal needs that he needs to pay his rent, go for normal functions, attend to family events. So you will find out that he drains the whole financial aspect of his life as well. Then he also goes to what they call isolation program, where people do not want to associate with him. A stigma program now occurs on the whole stage, where the guy feels judgmental over the whole event going on. People are after me now. Is going into what they call self-delusion, believing that he is the only one that is right and every other person is just ganging up against him. Now, we will also look at it from the wider environment, the kind of people that he keeps himself with. He will now want to belong with the same group that seems to, in quote, understand him. And you will find people willing to understand because everybody in those groups wants to exploit the other weaker guy. You'll find out, like the rule says, the pimp doesn't take his own drugs, and that's why he's the pimp. He sells the drugs, the dealer doesn't take his drug. He keeps the guy on the chain. So what does he do? He keeps him selling off everything he has. It keeps him stealing. So that's why you find that the social norms in the environment become so vulnerable that somebody can come and rob you of whatever you have and sell it for a peanut just to buy a drug that will just kick him in for just 1 to 2 hours, and he looks for another person to rob again. In the process of it, it leads to death and suicide. So if we look at it, it is a triage or a matrix that is not a pleasant ending. Most people end up having mental illness. Some actually die in the process of it because of overdose, because they couldn't get the desired result they are looking for. So they increase their dosage just to get the same effect they are looking for. So if you would say the effect affects everyone. The healthcare facilities will be burdened with their complaints coming in and out every time. The parents are tired because they don't know what to do with the child anymore. They have tried every other thing, counseling, prayer, depending on which religion you belong to. They have tried rehabilitations, they have tried police station locking up, and things are not working out. So at the end of the day is something called a big mess in terms of rehabilitation. Is because the guy does not understand who he is anymore. He has lost what they call the orientation of his own person, and is trying to find who is the next person that he thinks he is. So the effect we will say to ourselves is a national effect that affects both the father of the family, the individual, the family, and the country in general.
Thank you, sir. I mean, it's such an eye-opener. Drug addiction affects everybody, both the individual, the family, his socio-economic status, the nation as a whole. Just affects everyone and puts everybody at such a bad light. Okay, there's this funny observation we've observed, right? We notice that some people will take certain medications, get better, and move on like nothing happened. whereas some other people will take the same medication, get better, and then they can't let go. Is it possible that some people are more prone to getting addicted to certain type of drugs than the others?
Thank you. It's a matter of tolerance. You know, drug, uh, like I said, they are all chemicals. And the same way that two ladies, sorry, I'm using a lady, they will go into a pub or a club and they will have just two shots of drinks and one will lose sense of orientation in terms of time, space, and person, while the other is still fully coordinated. And we're wondering what is going on here. And the same thing happens with drugs as well. One of the things is what is your tolerance level in terms of what is your genetic makeup or your body composition. So you come along and you find out that what is your own pain threshold. And that's why most of the time we don't assume everybody, when somebody says I'm in pain and we're looking at the person because he's not screaming like the other lady screaming or the other guy screaming, we say, no, this one is not in pain. This one is in pain. No, we tend to look at each person as his own pain threshold. So we will say also in the same case, there's a threshold that actually people don't cross. And that's why each person kind of have what they call a self-assessment of what am I capable of, or what is my own threshold level. What I can handle may not be what you will be able to handle. So when we talk of why is it affecting one person and it's not affecting the other, it's just based on the personality of each and every individual. And that's why we say treatment is personalized. It is not generic. We will not use a cast on stone program to treat people. And we say, we look at you as an individual, assess what your background has been like, and assess what can work for you. And that goes for drugs also. And that's why we say if we treat you for a particular illness or condition, because your friend has that same illness or something that looks similar, does not give you the permission or the right to prescribe the same medication to your friend, because what your friend is going through may not be exact of what you are going through, because you are both not made up of the same genetic configuration. And that's why we look at it and say, please, can you talk to your physician about this condition? And also, we have learned to do what we say Google consultation. That helps us to look at events from a different point of view, forgetting that Google is a script written by somebody that does not have your social and environmental history to know what is going on, but just have only what they call your present history. So when you are talking with Google, please also find out before you take the final advice from Google about your present social condition. What is your social history? What is your environmental history? What has been your lifestyle in general, before you make that decision that Google is giving you. Google is beautiful if you apply wisdom to it, but is also a danger to you when you use it wrongfully. So going to your question, why do somebody react and the other one does not? It's just a genetic makeup. So your body needs to tell you what it is that you have and why you should stick to your own boundaries and stick to what they call your medical advice regarding every event that you take, including alcohol. Because people feel alcohol is not a substance abuse, but we have seen people that actually were normal in the morning and they got up in on the roadside by morning and wondering what exactly happened to them. So those are the things I will say. We should check who we are and know who we are before we embark on whatever we want to take.
Thank you very much, Dr. Oguguah. Like you said, people have different genetic makeups. We are all not the same, and we will all not react to drugs the same way another person will react to it. So it is important that you know your own limits. You know what ticks you off. You know what drugs you use, what particular drugs you use that makes you react a certain way. So you don't expect the same form of reaction that somebody else had, and it goes all awry. Now, the next question would be that can social factors play a role in drug abuse or drug addiction?
Tolu, yes, this is a major player in the industry of drug abuse. A social factor from, that's why in children right now we try to discourage peer pressure from nursery school, so that by the time they get into university, they know how to cope with such pressures. I want to belong. I want to be popular. I want to be known. I want to be. I all the bees that goes along the whole uh, cascade is what is causing most of these issues. And that's why parents have a lot of work to do in affirming and asserting the child from a tender age that you are unique and you are special in your own way. I have a child that the mother brought to me one time and was complaining that the girl was actually very, very social when she was in primary school, but now she's in secondary school and she's now keeping to herself, not talking to the family, does not want to have dinner with everybody, but wants to have dinner in her room alone. And I was wondering what exactly is going on over there. So I had a chat with her and I invited her to see me. So we kept on chatting. When you tell your daughter to come and see a doctor, you know the impression she's sick, or are you saying I'm having an issue? So because of the way I've been trained or the way I do my own consultancy, I started with the common things that everybody likes here. So what's happening with the social media right now? Kim Kardashian, I learned that Kim Kardashian is having a new boyfriend. He said, so you're also with I said, what do you take me for? Did you see the episode about the Big Brother going on? He said, wow. So you are actually in town. I said, I'm not like your parents. I'm not old school. I'm new school. So we keep on flowing. And for the next 15 minutes, we're actually talking about what this society is all talking about. And we were all there. And I said, come, by the way, I know you eat in your room. What's going on? Why is the food, is it better off in the room? In fact, me myself, I've been thinking about going to my room to start having my own dinner, or like saying, my parents are always just nagging, and I'm so tired about all those. I said, so what do you do when you nag? He said, I go to my room, I pour the food inside the toilet, and I flush it. Because there's a drug a friend of mine introduced me to, and he says, when I eat it, I won't gain weight, and I'll be firm, and everybody's calling me fat. I said, are you serious? They're calling you fat? He said, look at me, I don't think I'm fat, but everybody thinks I'm fat. Now, that's it. There's a problem here. She's not fat, but she thinks because everybody thinks she's fat, so she has to take some pills to lose weight. So I noticed that I have a game here. We need to talk about this properly. So I said, okay, you know what? Let's check what's the definition of fat? Let's look at those things. So we started researching together. We looked at the definition of somebody that is called fat, full cover, well endowed. And we looked at people they call skinny, slim. So we kept to a point where I said, okay, now based on all this definition, where do you put yourself? They said, well, I look fit. I said, are you sure you look fit? He said, yes, from what this says, I look fit. I said, okay, now, based on this, let's check my mirror. What does mirror on the wall? Tell me who you're looking at. And the mirror looks, and I said, tell me what you can see from the mirror. If I'm seeing somebody that looks good, I said, good. So next time they call you fat, what will you reply them? I look good. I said, fine. So this is one of the things that you should go back there and tell them. Then we kept on the discussion. 3 weeks after, I had a review with her to find out whether are we still taking the drugs. Well, off record, I never told the parents the drugs she's taking because she told me the name of the drug. I just told them, you know what, we're battling what they call a puberty stage. So she's changing from who she is to something she feels she's not. So we went 3 weeks after, she came back and said, you know what, I discovered that I went to go and research the drug, and I found out the drug actually can affect a lot of things in my system. My kidneys will shut down. I said, I'm happy that you did that. Now, can you see what your friends are putting you through? He said, now I know why this person does not come to school every time. Now I know why this person does. But this is one of an 100 or 100 that have taken time to engage a physician in this issue. A lot of them just depend on what my friend said, and a lot of parents feel that it's just the natural change. If you see changes happening in your child and you feel you are uncomfortable about it, it's time for you to raise it with a physician or a social worker that can actually break the barrier. Some parents are not open to discussing or having this kind of healthy discussions with their kids, so they need intervention. So I would say what our social life have done for us, and the pictures we see with the likes of Kim Kardashian and Ronaldo, Messi, France, and the likes, has created a misconception of what real life looks about or looks like. So I would say if we can help our youths or kids to live a more balanced life. I know right now telling any young person to be off his phone for about an hour is as if you just sentence the person to a life imprisonment or a life after death. So we will say parents need to balance the equation and see how we can manage those social pressures from school, from relationship, and from who are you exposing your child to is the most important. You must know what kind of friends your child is keeping and invite them home. Give them the room to come and do what they are doing in your own house for you to see what they do, how they talk. I have a friend that deliberately invites everybody every Friday and say, "Ooh, let's have a party." But the parents is doing that just to know what is the limit they can go. You understand me? So when we look at the social vibes that we are having there, we will tell ourselves that the social norms going around there, if you are a nerd, if you have not taken alcohol, you don't do drugs, you don't keep late nights, you are not an happening child, creates a wrong impression on the kids. My boy is 14 and is trying to now navigate between the best in class and the most liked in class. And I sat down with him and he said, "No, I'm a nerd." I said, "You are not a nerd. Who told you you're a nerd? You're a brilliant young boy. You are scoring the highest scores in school. You are in football. You play basketball. I don't see nerds playing basketball, football, playing all the sports, and also in dance." He said that they have stopped dancing. I said, "Why?" He said, "Because they said nerds don't dance." I said, "Who lied to you?" He said, "My teacher said I should." I said, "And I had a word with the teacher." I said, "Please, for your information, I pay school fees for you to teach my child's school, not to influence his thinking." You understand? Because some parents, some teachers don't understand their boundaries and their limitations. So after I finished having a word with the teacher, he apologized and said, "No, I didn't mean it that way." I said, "Whatever way you meant it, please, let's get the right statement right, correct out there. The child is good, the child is okay, and the child is behaving normal. You don't compare my child with any other child. You don't compare my child's performance with any other child's performance. My child's performance is based on his giftings and his talents. So I manage what his own giftings are, and I make sure that the giftings are what we want as our own family trait. So if each parent actually look out for what is going on in their own family, and make sure they monitor and they have what they call interactive sections. I know most of us have sourced all this parenting to our nannies and our caregivers and the teachers and the lessons. But we will pay the price in future when the guy comes back and says, but mommy, you are not there. Daddy, you are not there. But you say, I'm working to provide you I don't need your money. I don't need your game. I don't need the car. I need you. If you were there for me, I wouldn't have been this. If you were there for me, I wouldn't have been that. So parents, I feel we need to do more for these kids to guide and direct them properly to get the best of these social values that we also consider as a danger to the community. I will not say society is the enemy. I will say that we have not checkmate what we're allowing into our own private domain. And that's what the issue is. We are too busy doing what we need not to do instead of focusing on that child and helping that child to develop the best character the child can have and making him feel loved and cared for at every stage in his life.
Thank you, Dr. Oguguah. Thank you very much. Oh, wow, we have a lot of questions. I'll quickly answer this one. My question is it okay to stop medication without completing the dose? No, it is not okay. It's never okay. You should not stop your medication without completing the dose. You have a dosage regimen. You have been given 3 days. You don't stop it after the first day because you are feeling better, or you don't stop it after the second day because you are feeling better. You should always make sure you complete the dosage regimen given, complete the medications. Even if you have started feeling better before the end, please make sure you complete it. Okay, so Dr. Oguguah, at what point should someone seek for help? Either from the angle of drug abuse or from the angle of drug addiction? At what point should we seek for help?
Thank you. At what point should we seek for help? At the point when you realize that you are not in control of who you say you are. Yeah, we all assume that I know what I'm doing, in this generation X, we all know what we are doing. That I can handle it. I know what I'm doing. I can. Then until when it gets to the point where there is a breakdown. I will go back to my son. My son came and said that I got my acts together. I know my game. I have my game tight. I said, are you sure you have your game tight? He said, Daddy, I have my game tight. I said, okay, fine, no problem. So you don't need my advice, so you can do what you want to do. So I left him for a whole time. And my wife was raking. He's going to. I said, don't worry. He said he has his game tight. His grade started dropping. His sleep pattern changed. He started sleeping in class. I didn't bother. I knew that he would pick up in the second term. Then during the parents teachers meeting, they called me and they said to me that my child's behavior has changed. I said, call him, let him sit down and explain to us why has your behavior changed. And he was looking at me. Daddy, what are you talking about? I said, no. You remember we had a discussion in January when you told me you have your game tight, that you don't need any other support. He was now looking at me. I said, no, Daddy, I need your help. I said, oh, you know you need help. I said, yes. Now I am happy that you have realized that you need help. Now you will now understand what it means to be guided. This goes the same way for every guy, every lady out there. You need help as you grow, as you develop. When you are under any influence, whether it is called drugs or whatever it is, You will notice that you lose control when it gets to a point, and you need somebody that you will lean on. It may not be your parents, it may be an uncle, it may be a caregiver, it may be even your physician that will be your own backbone to lean on. Please utilize it. There is a warning sign that you will see called, I am losing it. My grades are dropping. I'm not eating enough. I'm not sleeping enough. I'm not having the kind of life I expect to have. I'm not taking care of my body. My hair looks scattered. I'm not having my regular brushing or bathing. And you notice that something is going on. Even if you have not seen it and somebody sees it, they should have a chat with you and say, you need help. And at that point in time, you need to see somebody to help you manage your health or your condition. I would say most of us believe doing what they call, in this part of the country, we have to force everything. We have to push everything into the throat of everybody. So if you push a drug addict to a point where you want to force him to go for treatment, he will go for the treatment. From experience, he will be there, but we call it presentism. He's just there but he's not participating. He's not cooperating with you, and he's not going to have any effect. It's just going to be a money down the drain. So one of the things I do when I see somebody addicted, I will ask you, have you gotten to your brick wall? I need to know. I need to know you are with me in this journey. I want to be sure you are not wasting my own time. I don't, because you have to get to a point where you'll be real with the person. So the person understands that, it's not all about me, it's about you. So whenever you are ready, I'm available for you. So the person has to make that conscious decision to know that I am ready. And to get them to that point of being ready is for them to now do what they call self-realization test. We do that for them when they notice that their friends are not there, nobody is around, what they call their gang, that gives them the moral support, that tells them that everything is okay, we are a family. And I asked them, the other guy that was part of your family, where is he? He's in jail. What about the other one? I thought his family. Where is he? He's dead. I said, now, can you say, wait, what did your family now do? That your other family? They are now blank. So you find that he gets to a point where realization or reality dawns on him, and he says, I need the help. What do I do next? Once you can get that question from a guy that is addicted, what do I do next? You know, is ready for the change. But if you have not gotten to the point of getting that question out of him to say, what do I do next? How can I get myself back? All effort we are doing is down the drain. We need to arrive at a decision with him, not without him or her, to make that decision. So at that point is when the help is needed. So when the boy comes to you, or you notice the boy is going down, and you'll say, whenever you need help, I'm available. And the boy comes to you and you say, okay, now let's do it. Now, there's also another part to it. When you have a child, it's difficult to look at your child about to die, and you say, you're waiting for him to say, those are what they call the stubborn, I die first before I ask for help. You have a right to report your own child. That he has no right to take his own life. We have organization like the NDLA that comes in and works with you to see how we can get the child off the program. So your child keeps coming back home and is now a threat to your life, to your household, and to everybody's safety at home. We will not wait for him to make a decision at that point in time. We need to call what they call external help. And external help could involve the police, the NDLA, the social worker, or somebody he respects and trusts within the environment. And at that point in time is when we should call for help. But when you look at it and ask yourself, where is the silver line on this whole program? It depends on who is wearing the shoe. There's no one jacket fits all when it comes to drug addiction. When it comes to drug addiction, you have to walk on the same path that the guy is walking to be able to understand what he's going through and to be able to walk him all the way and walk him out of that program for him to get his or her life back in order. So when do you look for help or when do you seek help is when the person is actually endangering his life or her life, or when the person reach out to you to say, how do I get out of this? Thank you.
Thank you very much. Thank you very much. Thank you very much. In mental health, there's something called insights. Now, when a patient lacks insight simply means you know that there's something wrong and you know that you should seek help for it. Now, when a patient lacks insight, it is extremely difficult to get that patient to feel better. It just means that patient does not even recognize that there's a problem. So whatever it is that you are doing is just pouring water into a basket. It's not going to yield any result. But wonderful patients that have insights get treated faster, and their treatment regimen or their healing process takes shorter, and the whole thing is even more permanent than those who lack insights. Anyways, let's go to the question and answers. This question is from Abolanle Rufai. It says, and it's directed to you, Dr. Oguguah. Sir, from your explanation on vitamin C and its sources, are you saying it's not right to take fruit, vitamin C sources, and vitamin C itself during treatment of malaria?
Yes, Abimbola, you're correct. It is not good to take fruit that contains vitamin C or vitamin C during the treatment of malaria because it interferes or interacts with your medication. And that's why we have what people call fake drug. There's nothing, well, I would say so far so good. Malaria drugs being approved by NAFDAC are not fake drugs. So if you see a NAFDAC approved malaria drugs and you took it without vitamin C containing substance, you will feel much more better. Your healing will become as prescribed and you will recover quicker.
Okay, thank you. Another question. My baby of 10 months currently has been stooling, however, is feeling better now. Is it okay to stop the zinc and oral drip?
Your baby has been stooling and is feeling okay now. Well, no. I would say continue with your with your oral ORT that you have been taking and let the baby recover what he has lost. One, children lose more fluid faster than adults. So we will not take it because the child you are seeing bouncing around now in the morning can actually break down in the evening because the electrolyte balance or the fluid balance is not yet established fully in the system. So what you are seeing is what they call the mirage stage of care. So let it enter the full recovery stage before you remove and ensure that the doctor has actually told you, okay, you can actually stop now based on the physical examination they have done for you and the test they have run on your child.
Yes, thank you, sir. This question, I think I answered it earlier. It is not okay to stop your medications even if you feel better without completing your dosage. You must always complete the dosage. If they say 10 days, take it for 10 days, not that you stop at day 2 because you are feeling better and you can now go to work, or your child is feeling better and is no longer stooling. If they say the medication is for 3 days, stop after 3 days, not that you stop because you are feeling better. You must always complete your dosage regimen even after you feel better. And also it's advisable that once you feel better, you should visit your doctor for your follow-up, and they'll be able to examine properly and tell you what next to do. Another very interesting question: does body weight affect adults in terms of number of dosage, like unlike children? I think that's the question. Do you understand, sir?
Okay, does body weight of an adult affect the dosage? Yes. If you notice, that's why we have adult medications are actually put there. And not all adults in quotes are actually of the same weight category. That's why you notice that they'll say per kg per. So you will notice that when a physician wants to give you the medication that is actually specific, your body weight really matters. We have the low body weight category people that you'll find that the person is an adult but is weighing between 50, 60 kg, and you find somebody that is 70 kg, 80 kg taking the same medication, and you're wondering, why is she taking 500 milligram and me too taking 500 milligram? At that point in time, it's not about your kg, it's about the drug. But when it comes to some particular medications like your drugs for your liver, your system flows, you'll find out that it is measured based on your kg, so that we do not have what they call overload. People can take medications and feel good, but if we have what they call your own body kg, meaning that adults from 70 and above or from 50 and above are taking this drug for a particular risk. So it depends on what drugs you are taking that we are saying is per body kg. No physicians will come and give you a medication blindly and say, because you're an adult, I don't want to know your weight. That's why you go to the hospital, and one of the first things they do is to check your weight and your height, just in case that the medications I want to give to you actually have to be calculated based on your weight. When we look at those body weight issues, it's more interesting in children, because any small changes in weight affects, or any small changes in the drug volume affects the child. Unlike adult, it does not show a significant difference, but it's more important in specific health conditions when we look at it. So it's not as if we're saying for like malaria, we don't use, we look at your body weight when you are, once you are adult, we tell you take, if you're using artesunate or one of those brown drugs, we say take one in the morning, one in the night. But you go to other brands, I will tell you, if you have 24 kg or less, take this. You will find some adults that are falling into very funny age brackets, and you cannot just look at them and say, I want to give you a blind check and say, because you are old and you have 25 years old, I will give you the drug. I will have to check whether can your body handle what we are giving to you. So it's based on the drug, it's based on the condition before we can say, oh, take it per kg. But if it's normal paracetamol, we can say, you can take your paracetamol. Like what I always tell you, I always tell people, take one paracetamol instead of two paracetamol. Nigerians like taking two paracetamol 3 times daily, feeling that it works better. But we have learned that one paracetamol can do actually a wonderful job as well for us in terms of painkillers and body aches and so. Thank you.
Thank you, sir. Okay, another question. This patient says that I also have been treating malaria for the past 2 months, receiving drugs and injections, and they seem not to work, as I am still having the same symptoms. What do I do? Okay, so let me even give a brief overview here. First, are we even sure it is malaria that you're having right now? That's first thing. Secondly, even if you have been investigated and it comes out malaria, the drugs you have been given, were you taking them properly? like we've learned now about the vitamin C. Are you sure you'll not be taking this medication with vitamin C? Or even before the vitamin C issue, are you sure it's not that you would feel better and then stop the medication, and then 3 days or 4 days after you have the same thing and you start again? But I'll let Dr. Oguguah shed more light on this.
Tolu, you are actually correct about this. People embark on what they call drug fancy or drug trip. They just feel like I've not gotten the right way I'm feeling, so I should continue on that medication. Meanwhile, the doctor has told you take it for 5 days and come back for a review. From her own statement, it's obvious that she has not actually done any tests, but she's judging her own recovery rate based on what her body is telling her. If you go down and run a laboratory test on this same person, you'll find out that she does not have any malaria case. It could just be a stress-induced program. It could just be that she's under a lot of stress that she's going through and her body is breaking down. So what I would advise you before you do any other thing is please go and see your physician. Describe all the medications you have taken from beginning to the end. Let them have a proper drug history from you, then run a complete test for us to know what exactly is going on. Now, because of a lot of drugs you have taken, there will be a lot of changes that will have occurred. So I would advise you right now, your best drug right now is to take a lot of water while you are going to go and see your physician so that you will flush out your system before you get in there. Again, please ensure you go to a physician that understands that laboratory investigations are important before treatment. We know a lot of people want to save money, but it's better for us to be wise in saving health or saving life than saving money. So please run the test. Based on your test, the way Dr. Tolu just explained to you, then you follow the prescription the doctor has given to you. After then, you come back for what they call a follow-up. Follow-up visit, people feel that there's no need, I'm already feeling better. The reason why you go for follow-up visits is for the doctor to reassess you and check to be sure that all the symptoms and all what you have just said have gone, and to run what they call a repeat test for us to see whether it's negative now. You will not get that if the doctor does not confirm you fit to fly or fit to walk or fit to continue what you are doing. And in most cases, nobody gets fitness of work anymore. We just have fitness to work, fitness to continue our hustle. Nobody wants to go back to the doctor. I think maybe Dr. Tolu, I think we should be putting lollipop and burgers and ice cream at the clinic so that people will come back for follow-up clinics, so that we will encourage them to come for follow-up clinic.
Okay, sir. I have another interesting question, of which I will answer again. The pediatrician has prescribed rather antibiotics. It is quite bitter. Can I stop when it feels better or complete the 3 days dose? No, ma. No, sir. Complete the dose. Regardless of how it tastes. I mean, many drugs are not sweet, to be honest. They just add flavors so that it is more palatable, but it is just for a short while. So please complete the dosage, not stopping when it feels better. No, complete the 3 days dosage as prescribed by the doctor. Now, Dr. Oguguah, this question is for you, sir. Is there anything like substandard drugs? Because we get to hospitals and drugs given does not work, which makes one return to the hospital for the same issue.
Wow, substandard drugs. Let's start from the fact that every drug you can find in the country being sold must first of all be approved by NAFDAC. Once a drug is being approved by NAFDAC and it has a NAFDAC registration number, that drug is fit for human consumption. So when you have a drug that has been approved by NAFDAC and you are seeing the NAFDAC process or registration number, first of all, it's not a substantial drug. It is an approved medication ready for consumption. Now, why do people say one drug is substandard and the other one is not? We have learned one thing in this in Nigeria, that people feel the more expensive the drug is, the more effect it produces in the body. So we are also looking for right now the gold paracetamol. Dr. Tolu, in case if you find a gold paracetamol, please let me know. I know a lot of my clients will be looking for the gold part, because the white paracetamol is no more working. They feel that chalk. But that same chalk you call chalk, if you take it properly, you'll find that you'll get the right effect in your system. So please, we have a belief that, in my own time, there's a word called Bicham. If you have Bicham, it's a drug. That's the best drug. And a chap came into the clinic and I was telling him, I'm not going to give you Bicham, I'm going to give you another drug. He said, no, it's Bicham or nothing. I said, do you know the guy that owns the Bicham has sold it to another person, that sold it to another person, has even forgotten that he owns that company. Right now, he's into tech industry. Say, I said, what you are buying right now is a label, not the person. Bicham is, so please, when the doctor gives you a drug, it's not the person that produces, whether it is Bicham or it's what the doctor has found to be efficacious for you and effective for you that makes sense. Not what you think or not the price of the drug. Yes, most of us feel that if you are living in a high place, if you should be taking first class. We found out that it's not so. We don't have a first class drug. We have effective drugs, and drugs are taken based on levels of the illness. We will not use a sledgehammer because we want to treat malaria, and now use a sledgehammer effect on the malaria. It will also affect you as well, because you will feel the after effect of all those things. So please, yes, we have quacks around. We will not deny or be ignorant of what the quacks are doing. But I believe that with the help of what even HMO is doing in the country, ensuring that we have healthcare affordable across the whole federation, nobody needs to patronize quacks in this country anymore. Everybody should be able to afford healthcare and be able to have what they call live an healthier life, a healthier, fuller life in this, and not be able to going back to ask whether the drug is whack on, what was that word you used again? It's been substandard. So it's so funny that we still have those flying around. I would say, one, before you take anything, ensure your physician knows about it. Ensure that you can see the date of manufacturing and expiration on it, to give you the sense of your own self-contribution to your own treatment, because it is you to guide against any such thing. And if you discover that your drugs you have been given have an expiring date and the date of expiration has gone off, please raise it to the medical advisor or your medical or your physician that is giving that this drug is not suitable for consumption. So thank you very much.
All right, sir. Thank you very much. Another question. From the discussion, I heard mixing different drugs isn't good, but I have been given 2 different anti-malaria drugs to take at once. I questioned this, but the doctor claims I have resistant malaria. What do you think I should do in this case?
Now, when your physician looks at your case and they feel that you have an issue that requires a combination of therapy, that's what we call it. Yes, they have actually considered the interactions of those drugs. First of all, to know whether it's going to add a positive effect on you, or is it going to add value to the treatment that we are going through. So what I will say to you is follow your physician's instruction and follow what his advice are. I believe that you are attending or seeing a qualified physician that has actually been fully trained. So he knows the two types of drugs is actually given to you. Now, sometimes you may look at it that why we have now what they call combined therapy in anti-malaria treatment, which is also combining 2-3 drugs together because some people don't like swallowing so much tablets for the efficacy of the treatment. Now, the physician may look at it from a different perspective and feels that, oh, your own condition requires a better solo treatment. So I would say follow his advice and follow his therapy and see the better outcome for you. Because he has run some tests and he has run some based on your history that he has looked at. So he have a better understanding of what is going on.
Thank you very much. Okay, we're almost coming to an end. So this next question, Sam, says that there are no rehabs in Nigeria to handle drug addiction. Isn't this a place the medical sector and government should look at? Places people are referred to for drug addiction treatment is usually the psychiatric hospital.
Okay, that's the most common, that's the popular places that, or locations where people actually refer people because they feel, in quote, they are mad. Because they are not actually mad, they are substance dependent people. So we try to label them differently and treat them differently. Even the Mental Health Association also have them grouped into other categories like that. So we have places like that have been created for mental health, like substance abuse, to be handled in the country. Some of them are privately owned. Some of them are NGO sponsored programs that they do a lot of wonderful work. There's a place in Jos that the man actually used an acre of land or so to do a drug rehabilitation program. He has no gate, he has no fence, but he has what they call a handover program. If anybody that tries to escape finds out that he's lost in the woods, and they wonder why does he have a large success rate. The guy interrogates them. One challenge that we have in drug rehabilitation is that people don't have an halfway home where they can go to and now know how to integrate into the society properly. So when we have this kind of facility, and we have others also in Lagos here that are doing great jobs in rehabilitating drug habits, drug addictions, and drug abuse people. So apart from the government facilities, there's a lot going on in the private sectors as well.
Okay, the last question, sir. Okay, I see a question from someone called Easy Weezy. Are banded drugs more effective than regular drugs? So even HMO made a short presentation on this on their Instagram page. So you can look at that and then get all the answers you need from there. It was very detailed and it's quite insightful. So because of our time, I'll just refer you there to get the answer. The last question, sir. Is it wise for a general doctor to attend to children or a pediatrician, or should it be a pediatrician only?
Thank you. This keeps coming up every time. I don't know why people, it's a very sensitive position that everybody's looking at. My child. That's the mindset they are coming from, is my child. And because the word pediatrician, people got so fancy, so intrigued about, he's a children's doctor. He's a children's doctor. But the general physician was trained to identify or to know what are the conditions that that a pediatrician needs to seek and the one that a pediatrician does not need to see. When we put every case at the door of the pediatrician, that means the most chronic cases that the pediatrician needs to see will not be seen by the people that need it the most. And that's why we have specialists in all fields. It's like me saying that for everything that happens to your body, you go and see orthopedics. Because you have a sprain on your hand, the orthopedist should see you. Or because you missed your period for one day, the gynecologist should see you. Or how do we say, because your eye is red, the ophthalmologist should see you. So we are overflogging the issue of the pediatrician seeing every child in the house. So what I would say to you is, endeavor, first of all, let the general physician see you, which is the norm across the world, that the physician sees you before the specialist sees you. If it's a case that requires the specialist to review, just in case we missed out something, the physician knows he needs to refer it to the specialist. But if it gets to a point where it is the normal, that is called primary health care, that issues that occur commonly among children. A child is vomiting, is stooling, his body is hot. The general physician sees it. But when it comes to that, the child has a protrudous vomiting or a diarrhea that is now becoming for 2 weeks, 3 weeks, and is not taking anything, then we know we need to call in a specialist in this case. So depending on the condition, so please, parents, I know your loved ones, your cuties, your baby needs to see the pediatrician, but remember, if you carry all the cases to the pediatrician, when you have an emergency that needs the pediatrician to actually see you on time, because everybody has taken the unnecessary cases to the pediatrician, you'll be delayed, and you will not be saying, they are wasting my time here. It's not wasting your time because everybody took the case that's supposed to be for the general physicians to see to the specialist. And it will not be nice for us to have an emergency and not be able to have somebody that will attend to us immediately. Please, parents, let's differentiate. Let the general physician see you. Then if you are not satisfied with the treatment being given to you, yes, you can request that, okay, can I see a pediatrician just for a secondary opinion? But I can guarantee you 90% of cases, the general physicians can sort you out and you'll be back home in no time.
Okay, thank you very much. I remember saying that was the last question, but this question is very important. I think it is. So this question is from Easy Busy. Interesting name. Is it drug abuse to take drugs inside eba, amala, or with coke?
That's interesting. You know, I get this kind of question with my geriatric patients when I see elderly people that comes and says, Doc, sorry for my Yoruba. Ogun yo lo lenu. And I said, Mama, how do you want to take it? He said, that means I put it inside eba and I swallow the thing. I said, Madam, there's no problem. The most important thing is one, we need to make sure the drug gets into your system and it works. We want to ensure that instead of you not taking the drugs at all and throwing the drugs into the toilet or flushing it down the drain, but you have something that goes into your system. When it gets inside your system, it will actually have the effect that you want. Some people don't like the drug taste, and so they try to hide it. So whichever way we take the drugs, especially not with alcohol, I always tell people, avoid taking your drugs with alcohol. Alcohol is also another chemical substance that can react. So please, as much as possible, as you can, drink water with your drugs. But if it's difficult and you feel the taste is not allowing you to swallow the drug, please put it in your fufu if you can. And swallow the drug. I need my drugs to work in your system. That's most important. Thank you.
Thank you very much, Dr. Oguguah. So we have come to the end of this webinar. Thank you very much for this session. Thank you to our listeners. Thank you to our viewers. We do not take it for granted. Thank you once again, Dr. Oguguah, for this session. It was quite interesting and insightful. We hope you have gained some knowledge and you can apply this to your day-to-day activities. Please remember to follow us on our social media pages. We are on Facebook, Instagram, and for even a release. Thank you very much for tuning in. And like I said again, we do not take it for granted. Thank you very much for choosing the Ejinkeonye Oguguah. See you next time. Bye.